Welcome to our infomercial about psychopharmacotherapy and anesthesiology assistance. I am Will Bowles.
My name is Michelle Grimes.
My name is Braden Lazaroff.
I'm Katie Kramer.
And my name is Ava Myers. All right, first off, we'll be figuring out what an anesthesiologist assistant is. So a certified anesthesiologist assistant helps implement anesthesia care to patients under the direction of a licensed anesthesiologist. On average, they make around $95,000 to $180,000 per year. CAA must work under the team of a licensed anesthesiologist, meaning they can't open their own practice. So they work in hospitals, pain clinics, and medical centers, but they can work anywhere that involves a surgery setting. And so on the daily tasks they must do every day, they need to collect pre-anesthetic data for patients before they put the patient on anesthetic care, perform and assist in routine lab work, establish invasive and non-invasive ways to monitor their patients, inducing, maintaining, and altering anesthesia levels, assisting in post-anesthesia, and yeah, that's what they do.
Okay, so how exactly do you become an anesthesiologist assistant? Well, the first thing you have to do is attain a bachelor's degree, and you want to make sure that it has a really good pre-medical program. So you're going to take classes such as organic chemistry, calculus, biology, just so that you have all the requirements needed. So when you apply to your master's program, when you're selecting this master's program in anesthesiology, you want to make sure that it's accredited by the CAAHEP, which is also known as the Commission on Accreditation of Allied Health and Education Programs. So when you're applying to this, you want to technically have a minimum 3.0 GPA, but to be competitive, you've got to have probably 3.5 to 3.7 range. You are going to have to submit an MCAT or GRE. Some of them require you to submit both. You want to have at least 499 MCAT or 152 GRE. Then you're going to obtain your certification. This is going to allow you to be finally a certified anesthesiologist assistant. And this certification exam is going to be administered by the NCCAA, which is called the National Commission for Certification of the Anesthesiologist Assistants. And you want to keep this by having 40 hours of CME, which is continuing medical education required every 2 years. And you're going to have to take a CDQ exam every 6 years just to keep up to date with things. And lastly, you get to apply for your license. And the terms and conditions on this will vary by state, but that's all you got to do.
So what is psychopharmacotherapy? Psychopharmacotherapy belongs to the field of psychological medicine, and it uses pharmacological agents to treat mental disorders. These can be antidepressants or more experimental that are approved by the FDA, such as psilocybin or LSD. Current interests in recent years, much of the practice has moved towards the direction of state of mind altering substances, such as lysergic acid dimethylide, to provide treatment for PTSD, depression, and anxiety. And the demand for this field is high, as about 1 in 6 people are currently prescribed psychotropic drugs. So a psychopharmacotherapist will analyze a patient and determine if a use of one of these drugs is needed or beneficial. And they will also facilitate the use and treatment of these drugs to treat these mental disorders. A possible duty of psychopharmacotherapy will also be to develop treatments in a lab setting, to further research, and to make new methods of treatment, because it's a growing field that changes with new data every year. The pay ranges based on what state you're in, or if you're connected to a larger company. And the pay is between about $87,000 to $218,000 on the higher range.
Okay, so how would you go about the education for getting into psychopharmacotherapy? First off, you would start by getting a bachelor's degree in a psych-related field. There's lots of options for psych programs. It just depends on your university, but it's not very strict on which one you lean towards. Second, you would apply for a master's of psychopharmacology and or a doctorate program of psychology. Many programs include both of these degrees, but some you'll have to do one, complete it, and then start the other. Once you complete these programs, you must complete 2,000 practicum hours as a psychologist before a licensure exam, and then after you finish that, you will need 2,000 more hours, and this you'd be working hours. Third, you would need to take the EPPP exam. This is required for all professionals who wish to work in psychology. A minimum score of 70% is required. Once you've passed, you need to work a minimum of 2 degrees in a psychological position and show proficiency in your work. Lastly, you would apply to a psychopharmacology program. If you've done all these steps and have been successful in your field, you've been doing your job and you have the rec letters and just the people that have worked with you and know that you're good at your job, you should acceptance should not be a problem.
Hello, I'm Katie, and I'm here to talk about the future careers in these professions. They include a psychiatrist and mental health counselor for someone who has studied psychopharmacology, and an anesthesiologist assistant and anesthesia technician for someone who has been on the AA track. So while there are a wide variety of career options in these fields of study, a psychiatrist is a great career for someone who has studied psychopharmacology because of their extensive knowledge on being able to identify what therapy or prescription a patient may need to manage a mental disorder. And then a mental health counselor would also be a great career for a psychopharmacologist because of their knowledge of different types of drugs. In this career, they would be able to use their abilities to analyze what a patient needs as far as treating mental conditions like depression, grief, anxiety, that sort of thing. And then an anesthesiologist assistant is the primary job of someone who has been on the AA track, and they can only practice under the supervision of an anesthesiologist, and their duties vary depending on what local practice they're part of. And then an anesthesiologist technician is commonly referred to as an AT. They handle all the equipment that goes into giving the anesthesia, but they also manage the maintenance. They clean it, they test it, they calibrate it, that sort of thing. And they're employed in the areas of the hospital such as trauma, transplant, and anything else that would need anesthetic. These are our sources, and we hope you enjoyed our infomercial.
Thank you for listening.